Welcome to Rehab Now, brought to you by the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Dank, and Almighty Studios. Today we have consultant physiatrist Dr. Paula Dawson, our rehabilitation medical doctor. What's up, Doc?
Nothing much. How are you?
I'm good, Doc.
Hi, listeners.
What's up, listeners?
What's up? What's up?
Thank you for joining us. I'm your host, Alicia Taylor. Remember to check out our social media pages on Instagram. It's Rehab Caribbean. Oh, Rehab Institute Caribbean. Dr. Paula Dawson and Alicia Taylor Music for Facebook. It's Rehabilitation Institute of the Caribbean. And our website, rehabcaribbean.com. Also, yeah, man, our YouTube page, our YouTube channel.
I forgot this time.
Rehab Caribbean. So go on and check us out. So this week,
Yes.
we're dealing with heel pain.
Heel pain.
Heel pain. We gotta heal all the pain.
Oh, you got that, listeners?
Yeah, man.
Heel.
But specifically, Achilles Tendonitis. I don't know why we have to have such really big expressions.
Yes.
I feel like it's for people like us just not to understand, but it's okay. So you can explain what Achilles tendonitis is. Oh, thank you.
All right. So the Achilles is a tendon. That's why I get Achilles tendonitis.
You don't even know what a
All
tendon
right.
is.
You know what a tendon is. A tendon is that fibrous white thing that attaches a muscle to bone.
Okay.
So look at the chicken leg. You know chicken leg, right?
Yeah, man. Well, always
You know the fat part of the chicken leg, and as the chicken leg about to go to the end, you have that little plasticky, nice, gristly, softy part. Not the gristle part, you know.
That part I can eat.
What do you mean?
The tendon part.
Of course, it tastes
come
nice.
eat it all the way.
I like it.
Yeah, I never want nobody judge me, but I just want to make sure. I eat it all the time.
But it's a no way.
Yeah, whenever like, oh, okay.
Anyway, so you eat the tendon, the chicken legs.
I don't them get chicken tenders from? Tendon?
Jeez, no.
Alright, just ask. It makes sense.
This is a medical show, by the way.
Right, sorry.
So we're talking
at
about
the tendon. Got it.
Right. So Achilles tendon. So the Achilles is that plastic, almost like a fibrous looking white. If you were to cut the leg when you're doing surgery, it would be nice white and almost silvery shiny. And so it attaches the calf muscle to the back of your heel, the calcaneus. The heel is called the calcaneus.
It sounds like Superman kind of thing.
Yeah.
Which planet him come from again?
Krypton.
Yeah, man, it sounds like one of them so many.
How?
Altanius, Krypton. It says Kryptonian. It sounds...
Okay, guys. So then I have to say, although you might say more big word, the soleus and the gastrocnemius, two muscles, go through the Achilles tendon to connect to the heel.
Okay.
And those two muscles will allow you to point your toes down.
Oh.
Plantar flex.
Okay.
So you ever see a ballerina, you notice how their calf muscles nicely developed when you're athletic?
Okay.
Yeah, man. And when you're not athletic, when you're
Plantar
talent.
fasciitis. So you know me, I talk about plantar fasciitis. Is that a thing?
Yes, it is.
Yeah, man.
We'll talk about that. That is foot bottom pain. That's foot bottom pain. She mentioned plantar fasciitis, but we'll get to plantar fasciitis. But
Because we're at the heel.
exactly, from the heel to the foot bottom.
Nice.
Right. And so the calf muscles made up of the soleus and the gastrocnemius, those muscles will travel through or connected to the Achilles and connect to the calcaneus, which is the big bone of your heel, and allow you to plantar flex, point your toes, to walk on your toes. And so...
Walk on your toes, love it.
Yeah. And so that is one cause of heel pain. So when that tendon becomes inflamed, you get tendonitis.
So Achilles tendonitis is heel pain.
It is one cause of heel pain because there are other causes of heel pain. So you can have lateral heel pain, which can be anything. It can be, I just going to tell you the acronym, ATFL, anterior talar leg. Fibular ligament.
That's
when you sprain the ankle.
Say it again.
Anterior talar fibular ligament.
Oh, Taylor is in there.
Talo, T-A-L-O.
Close enough to my name.
And then the medial, on the inside of the ankle, is deltoid ligament. And then the foot bottom, you can get heel spurs, you can get plantar fasciitis. Yeah, right. And then you have something called pump bump. Pump bump.
A joke, am I right?
No, that's serious. It's actually a medical
Pump
term.
bump. Why? What that mean?
Because, all right, so it's actually, you know, like when you wear pumps, which is shoes.
Oh God, like heels?
Right, and just where the heels touch the back of your heel, you see some people will have a little fat swelling, and it becomes very painful. That's called a pump bump. A pump bump. Anyway, so those are different causes of heel pain, and then you have some other things that you can get. Again, bursitis. You can get nerve injuries around the ankle joint, but let's stick to Achilles.
As long as I can't get arthritis, I'm good.
You can actually get arthritis in the ankle.
Make it
Ladies and gentlemen, if you're listening to this show for the first time, Alicia Taylor does not like to hear about arthritis. She said arthritis is not everything.
I hate it. Enough.
Remember, see, you can have arthritis inside your inner ear. Remember I told you?
When you told me that, I just gave up. I was like,
don't give up.
You can't
There is
escape.
hope. It
You
just
can't
goes to show
escape.
you how amazing God is. And if you maintain strengthening, flexibility, you can put these things far from you.
It's true.
Far, far from you. And so let's talk about Achilles tendonitis. What the person complains of?
Pain.
Pain. Pain when they do what?
When they flex, when they... No?
Yeah, man.
Okay, when they point.
Right. So when they try to walk,
Yeah.
exactly. When they try to walk, especially when they're going uphill, because when you're going uphill, you kind of stretch the tendon. Right, when you're going downstairs as well, you can go actually up and downstairs. You can have pain in the back of your heel, and it can be tender to touch. They can also tell you that they feel like the tendon is thickening, and that's when tendonitis changes to tendinosis. So with tendinosis, remember I told you about tendinosis from the last episode. So tendonitis. Let me just say tendinosis when the structure, collagen, in the tendon is disorganized. And so it can tear easily. You can tear your Achilles tendon. And it's called a tennis leg.
Sure.
It is actually called a tennis leg.
Is there anything you call like a golf leg or no?
No,
Just tennis.
just tennis leg. It's actually called a tennis leg. In fact, David Beckham, I don't know, you know David Beckham?
Oh, of course, yeah.
Playing football, I remember the match so clearly. He's walking backwards. Achilles tendon rupture.
No, but why am I walk backwards?
You know,
it's a football team.
No, man. When the ball and the ball coming down. Remember, some used to play football for Jamaica.
No, remember, so you used to play for thing, you know.
No, just them two. Cricket and football.
Football, cricket. You never used to run to.
Yeah, we kind of don't.
You never
But
played
not
netball.
national, bro.
You never play tennis.
Never played tennis. I remember once I run at the stadium and somebody said I was going in reverse when everybody run gone. I was running against some top athlete. I know it was terrible. But anyway.
Yeah, so tennis.
Tennis, right. So all right, so go back to tennis leg. So what tennis leg is, so right where the muscle, the calf muscle, meets the tendon, you actually tear the myotendinous junction, which is where the muscle myo, remember myofascial?
Yeah, man,
Myotendinous junction. So that's tennis leg. In fact, how you feel tennis leg, you can't just be walking along and you literally feel like somebody hit you on the back of your leg with a stone. And so it just ruptures. And that comes usually in people who are not very athletic. Donovan Bailey, Canadian sprinter, my friend, big up Donovan. He actually ruptured his Achilles, and then he did his rehab, did his surgery, and he was the first man to run sub 10 in 100 meter. Right. And so you can rupture your Achilles, you can have Achilles tendonitis, and there's a lot of pain and swelling around your Achilles tendon.
Okay, so there's this thing at your ankle, right? And it feels like a string. Well, not really one string, but it feels thick.
But that's Achilles tendon.
That is the Achilles tendon?
I guess I
That's
never
what I
explained it
asked.
properly.
That's what I was asking. Boy, that's painful, then, dog. That's what I wanted to know.
That string. That
the
same
string, is it?
That little string at the back of just above the heel back.
Interesting.
That is the Achilles tendon.
That is your Achilles.
And so the Achilles is just almost like a fibrous whitish silver band, which comes up to the calf muscle, and which is what pulls. It's almost like a lever system to allow you to point your toes down.
Interesting, When I was younger, I was in an accident.
Oh no!
So unfortunate. But anywho, it wasn't bad. It was just a bike. My ankle got itch between the brake on the bike and the muffler.
Ouch.
Yeah, it was terrible.
You got burnt as well.
Yeah, man, I got burned. I still have the scar. So I could not walk because
Ouch.
the Achilles.
It was painful.
Yeah, man, I don't know what it was. I don't know what happened to it. Of course, as a child, so nobody never explained it properly to me. But they were telling me that I wouldn't be able to walk.
Oh no.
Yes, I'm trying to figure out
That
if you can injure your Achilles tendon or whatever it is, your Achilles, to the point where you're not able to use that, leg or not able to walk.
Even if you rupture your Achilles tendon, you can still walk. You just walk with a kind of a floppy foot, right? So I guess when Jamaican people say you're not going to be able to walk, they mean walk properly.
What Jamaican people
It's true. When people say
traumatized
it's
me.
true. When people, everything they say, you must walk.
Walk. I was just like, what do you mean?
They mean walk properly. I think that's what they mean.
I was traumatized. It's like,
God. But good thing it never got to you because here you are.
yeah, okay. I didn't know that was
So
Achilles.
just like you say, I like the fact that you said that string at the back of your heel that goes to the fat part of your calf. That is the Achilles.
I like the Achilles.
And then you see, because the Achilles is one of those tendons that you can't walk on your toes. And so there's something, the gait cycle, G-A-I-T, not gait, G-A-T. The gait cycle is ambulation, which is walking. So the first contact is heel strike, loading phase, and then toe off, when the toe goes off. For you to get in the toe off phase, you have to recruit your Achilles tendon in a sense, because you're now pointing your toes down.
Okay.
So it's almost like when you're running and you're digging. You ever run racing?
Yes, I have actually.
Did you know that I ran sports day a few weeks ago and pulled my hamstring? It was funny. Anyways, we have to do the hamstring thing. But anyway, so the toe off. So what will happen, I believe what they were trying to tell you as a child, is that it would affect your gait cycle. So the toe off, so instead of toe off, you probably just have to lift your foot and bring your foot forward in a sense, as opposed to, right?
Yeah, that's a lot of...
Yeah, but the Achilles tendon is very difficult to rupture because it's so thick.
Yeah, because I'm just like, how you rupture something like that,
But here's how you rupture. So the Achilles tendon, just like any joint in the body, you have range of motion.
Okay.
Range of motion. So we're going to talk about that, I suppose, when we come back, where you have, why is it that you get Achilles tendonitis? Why you get Achilles tendon rupture? Why you get tendinosis? Why you get pain around the area and pump a bump?
You know what? I'm going to take a break on that pump bump. Stay with us. We'll be right back.
Yes.
Welcome back to Rehab now. If you're just joining us, we're talking about Achilles tendonitis.
Yes.
And when we left off, we were talking about the rupturing of the Achilles and just how difficult that is to do because it's so thick, right?
Tendon, yes, it is.
Strong, man. You can't rupture that. How you rupture that? So, sorry, go ahead, Doc. Sorry.
So the question is, why would my Achilles tendon become inflamed to give me a tendonitis? All right, and it comes from it comes from decreased flexibility. So when your calves get tight and you can't dorsiflex, when dorsiflex is cock up your toes.
You really like use the word cock up. I just love that. Cock up your foot.
You know,
cock
there's
up
a
your toes.
difference. How else can you tell somebody to bring the toes up? Anytime you tell somebody to bring the toes up, they bring up the whole leg.
How we understand cock up your foot, cock up your leg? That's just where I to get it.
Right. Actually, there's a cock up splint. And actually written on the back, cock up splint. Splint that we spoke about that. It keeps your wrist in extension. Right. So anyways, so let's talk about what talk about again?
Sorry. With the Achilles.
The Achilles. Right. And so decreased range of motion at the Achilles, where the heel cord tightens. Right. And athletes, one of the, as you know, many of our athletes would have Achilles tendonitis. The other day, Elaine had it some time ago. You know, she came back from the injury for the Achilles. A few of the athletes will get Achilles tendonitis because
Just because they're using it.
Well, I'm glad you asked. Why? Because it can be one, decreased range of motion when you don't have the flexibility through your calves. You can't do the dorsiflexion properly. One, it can be overuse, continuous recruiting, and ballerina can get it because they're always walking on their toes. Kids who toe walk a lot. And it can also be related to your footwear.
Talk to me about footwear.
Right. And so, you know, if you have a shoe that is not putting your feet in the right position, that can predispose you to Achilles tendonitis. That's one. Two, it can be the surface that you're training on. If the surface is uneven and you're always having a continuous moment, not moment in time, but moment in physics, moment is movement. Right, so if you are running, you're supposed to heel strike and your heel is supposed to hit the ground, and then you go off on your toe. But if you keep having like a like an unstable movement, that extra moment can cause inflammation in the tendon. I have patients who they get it because of how when they're driving with their heel laterally tilted. And that lateral tilt kind of puts pressure. It's positioned just like when you're sitting at a computer and you're keeping your neck in one position for long, or your hands in one position for long. You can get tendonitis around your elbows or your wrists. You can get it because of how, like drivers, if they have their ankle set in the wrong position. Now, there's also, there's something called pronated foot. Flat foot is pronated.
Oh my God, I just wrote it down, so I was going to ask you about it.
Flat foot and supine. Go ahead.
Flat foot and what other one called? Because the other one
Pes cavus.
Oh, wow.
Pes cavus, where you have high arch.
Yeah, man, that's me. High arch. So persons with flat foot.
Pes planus, P-E-S. Pes is foot, P-E-S. Planus, like a plane, flat, P-L-A-N-U-S.
So that's me. Pes
That's
planus.
flat foot or pronated. I thought you said the archer.
No, I'm the archer.
Pes cavus.
Ooh.
C-A-V-U-S, like a cave. You have a hole under your foot bottom.
That's not nice. That's not cute. Pes cavus. You know what? I'll just call it archer.
Archer.
Or the arching. Anyway, yes,
Right.
so persons with flat foot.
Yes.
Pes planus.
Yes.
And those with the arch.
Pes cavus.
Pes cavus.
Yes.
Which one is more prone to just
Causing.
getting like a them what are some of them Achilles?
Both.
Two of them?
Both.
Did I
I'm
always
glad you asked that question. Why? Because the perfect mechanics is the perfect mechanics. And anything outside of that will load the tendon asymmetrically.
So you have somebody who's in between pes planus and pes
a neutral
cavus.
foot.
Neutral foot?
Like you're like
so
some
boring.
people, when you're born with a neutral foot.
Yeah, people who have neutral foot.
My right foot is neutral, my left foot has pes planus.
Doc, you're such a strange one. I'm going to have to look at your foot because I want to see.
Yes, one of my foot I have turning, pronated. So it's pronated, it's turning, flat foot, and the other one is perfectly fine.
So okay.
Yeah, and that's just biomechanics because I stand more on one foot and then one foot is weaker and all sorts of stuff from sport, blah, blah, blah.
It's unfortunate for me though with the knock knee and then the pes cavus.
But we can sort that out, Alicia.
Okay, great. So you say both
Right.
pes planus and pes cavus
Can predispose you to Achilles tendonitis. And so it's really, so it can be traumatic. Let me not forget traumatic. It can be traumatic as well. So you can be running and you slide or you twist your foot or something like that. That can cause inflammation.
or a
around
bike injury.
Right. Now there's also a bursa right by, you remember I told you about a bursa, which is a cushion sack. So there's a bursa right by the Achilles, and that bursa can get so inflamed, and that's what give you the pump bump. So some people, when they wear shoes, like heels, and that heel rests on the back of their heel, that's shoe. English language, something else,
It's confusing.
What are heels?
Necessarily.
What are heels?
What do you mean? Which one?
Exactly my point. And then now you have heels that you wear. You have heels a part of your body.
Yeah.
And then you can heal somebody when they're sick.
It's.
I am sorry for anybody who's trying to learn English language.
I bet we're gonna learn French.
Bonjour.
Ça va?
Bien merci.
Oh, you know French,
Comme
right?
ça.
True, man. All right.
Anyways,
So let's continue. Sorry.
Right. And so the Achilles tendonitis, you get anytime there is one, decreased range of motion, strain in the Achilles, you can get these little micro tears in the Achilles. So if you do nothing to the Achilles, over time, you will get tendinosis. Again, mentioning tendinosis. So some patients will tell you, my the same string at the back of your heel is getting thicker and thicker and thicker.
Wait, getting thicker is bad.
Bad. It's very bad.
But it getting thinner is also bad?
It doesn't normally get thinner. You can get thinner
Okay, it
Achilles
can
if
get-
you're
okay.
bedridden and you're not using it, and you can get atrophy.
Yeah, okay. Well,
Right.
fine, that makes
but,
sense.
But the tendinosis, the tendon gets thicker. Now, when the tendon gets thicker, the tendon is not, the integrity of the tendon is compromised. What do I mean by that? So the collagen fibers are no longer organized; they're disorganized. So normal organization, they slide in a particular linear way. But when you have tendinosis, they're disorganized, and so when that happens, the tendon is weaker, and then it can rupture. Yeah, and then it can rupture.
But that sounds like it's like a serious stage. That's not like a.
It's a serious stage.
Okay.
And then of course, body habitus too. If you're too heavy,
heavy,
putting too much weight on your ankle can lead to inflammation around the Achilles tendon as well.
That makes perfect sense.
It
Doc.
does?
Yeah, it does. When you see some persons and you're just like, oh, okay.
Right.
Makes sense.
And that will give you heel pain. And that can give you heel pain. And the question is, what do you do?
Yeah, I was just gonna say, how do you treat that? Wait. You don't start with rehab. You still
start with rehab. You still have to follow an algorithm, and the algorithm, you can't go wrong with an algorithm. So the first thing this time when you start with rehab and physiotherapy, you start with biomechanics. So you look at why. If it's traumatic, well, you just have to go through the course of healing. If it's biomechanics, you have to fix the biomechanics, because even if you quiet the inflammation on the Achilles tendon and the biomechanical problem is still there, it's always going to come back.
Yeah.
So if you have flat foot, we can give you arch support. Right.
And if you have arch foot, what are you going to give us?
We can do foot rehab. We can actually do foot rehab to try and get to help back the.
You feel like we need foot rehab, doc? Is it that serious?
If it's bothering you.
No.
If it's not bothering you, then you're fine.
No, my pescavus. Yeah,
In
my
fact, a
pescavus
cavus
now bother
foot,
me.
a pescavus foot, there's something called windlass. I think I mentioned it before. The pescavus foot is probably the most ideal position for your foot.
I'm saying, right?
Right. It's windlass. Windlass. All right. And so, what we want to do is to correct the biomechanics.
Okay.
You may need arch support to keep the foot in position so you're not moving too much. Because every time when you step, if you're pronated, you'll keep rocking across the ankle. And every time the Achilles tendon gets some pressure, right? So then after that, you get back the range of motion. Tight heel, tight calves. You have to stretch out your calf. And then strengthen it eccentrically. Something called eccentric strengthening. So you learned that the last time. So you have isometric, concentric, and eccentric contraction of the muscle. So when you contract the muscle and it lengthens, that's eccentric. When you contract the muscle and it doesn't move in terms of changing the length, that's isometric. And then when you bend the elbow, your short is called concentric.
I feel like I have to have like a doctor's brain to be able to remember all of these things.
But you know what? You are doing pretty well.
Thanks, doc. I'm not doing as well as you. You
What do you
understand?
say?
Yeah, man.
Well,
No.
I can sing as well as you. She's a singer, guys. Sing something.
Interesting.
All right. and then so once we get back the range of motion, then we do the therapy. Now, the wonderful thing about physical therapy and I should have a physical therapist talk about it because I'm not a physical therapist, because they're so amazing in treating.
They really are.
Yeah, man. They use modalities. Shockwave around the Achilles. That's one of the most known treatment for Achilles tendonitis, because it helps to change the tendinosis back to tendonitis, because it causes neovascularization. It causes blood to flow again.
Oh, I try to degrade.
Right, so that it can heal. I mean, there's so many things that they do. They use ultrasound. They use different modalities of strengthening and pain management. But of course, range of motion, strengthening, paramount. And biomechanic correction. Once you correct biomechanics, that's important. The next thing, though, we can inject around the heel.
Around it and not it.
Not in it. Once you inject in the tendon can actually rupture. Steroids will mess with the integrity, right? But then, I like the fact that you said that, because you can use PRP, platelet-rich plasma,
Yes.
and that will help to heal around it. The last resort is surgery. So the orthopedic surgeon can actually go and correct, because if it's inflamed and you have tendinosis, they can actually cut out the tendon. I'm not an orthopedic surgeon, and put a graft and do some nice fancy high-tech orthopedic surgery correction and the patients do very well. So if we can't help, then we step up to the surgeons, the orthopedic surgeons, and they can do the correction.
So so the surgeons, let me see if I can get this right. So they can cut out the tendon.
Yes.
When they cut out the tendon, does that mean they're cutting like a piece of the Achilles?
Yes, I think so. Yes, they do. And they can get a graft. Allograft, you get a graft. A graft is like, when you grab something, you get a piece for something and patch it. Right.
Yeah. What exactly a graft? It's like a piece of iron? What we a graft?
No. Your graft is similar tissue.
Oh,
Your
where you
graft
get that tissue from?
It can be commercially made.
Wait, I'm sorry. I never read it. What do you mean commercially made?
Many things that, just like when you have joints, you can buy joint. Well, when you do a knee joint, when you do a shoulder joint replacement, when you do joint replacements.
No,
right?
you can't buy joints.
You can replace many things in the body. You can replace your lens, your eye, cataract surgery.
Yeah, man. I didn't know about your kidneys.
Your kidney?
Yeah, you can't replace a kidney. You can't.
Kidney transplant, no, but that's not an artificial kidney. Somebody's kidney you get.
Yeah, that made it mean.
Okay.
That's what I mean when you say like.
Yes.
Okay, so that them can make them. Can they put iron there?
No,
iron can't go because it needs to flex.
Yes. Oh. See, but when you're doing grafting, and you probably should get an orthopedist to talk about it. But you can get allograft and you can get autograft, which not autograft.
Yes, the medicine.
Not G-R-A-F-T, not G-R-A-P-H, not your autograph like we'd get from you, Alicia Taylor.
Whoa.
I know. But graft, G-R-A-F-T, when you're grafting, bringing in some.
I know okay, I liked it. You know what? Is that it? Is that all, Doc?
I think so.
Yeah, man. Thank you so much for joining. I had fun with Achilles tendon, or tendonitis, and I hope you guys really learned something today. Thank you to Power 106, our show producers, our engineer. Thank you. Rehabilitation Institute of the Caribbean is located at Suite 2A to C Ligony Post Mall, 115 Hope Road. Our sponsors, the Rehabilitation Institute of the Caribbean, providing medical care for function and performance in association with Winchester MRI, Jamaica's first choice for MR imaging, Immune Active Denk, a combination of key active ingredients designed to boost the body's natural defense, and of course, Almighty Studios, a recording studio where we create worship music to praise and to worship and to serve. And that's all we have time for. Thank you. Love you. Bye-bye.
Thank you. Blessings.